What is spike and wave discharge in epilepsy absence seizures? Have you ever wondered what happens in the brain during an absence seizure? One key feature is something called spike and wave discharge. This is a specific pattern of brain activity that can be seen on an electroencephalogram, or EEG, during these seizures. Absence seizures are a type of epilepsy that often occur in children and are characterized by brief lapses in consciousness. So, what exactly is spike and wave discharge? It consists of a repetitive sequence of sharp spikes followed by slower waves. This pattern reflects abnormal electrical activity in the brain, particularly between two important areas, the cerebral cortex and the thalamus. These regions play crucial roles in controlling awareness and processing sensory information. The spike, part of the discharge, happens when there is a sudden and intense change in the electrical state of neurons. This is known as a paroxysmal depolarizing shift. It occurs mainly because of a rapid influx of sodium ions entering the neurons through special channels. This influx causes neurons to fire bursts of electrical signals, known as action potentials. Following the spike, the wave phase occurs. This is when the neurons start to return to their resting state. During this phase, potassium channels are activated, and the neurons undergo repolarization and hyperpolarization. This cycle of spikes and waves repeats rhythmically, creating the distinctive EEG pattern associated with absence seizures. What is particularly interesting is that this abnormal firing happens simultaneously across both sides of the brain. This synchronized activity involves the thalamocortical network, which includes the outer layer of the brain and the thalamus, a key relay center for sensory and motor signals. The interaction between excitatory and inhibitory neurons in this network generates the spike and wave discharges that lead to the brief loss of awareness seen in absence seizures. Understanding spike and wave discharge is essential for diagnosing absence epilepsy, especially in children. It also sheds light on how seizures are generated in the brain and can help identify potential treatment targets. In summary, spike and wave discharge is a rhythmic pattern of abnormal electrical activity in the brain that leads to the transient loss of awareness typical of absence seizures. If you suspect someone may be experiencing absence seizures, it is important to consult a healthcare professional for proper evaluation and management.